Good evening, everyone, and welcome. Thank you so much for your presence this evening. Following Jeremy, the two presenters' presentations, it just strikes me in terms of the importance of collaboration. These efforts of science and impact are not strictly just individual efforts, but are interdisciplinary. And I think it's also important of listening to communities and really seeking to impact just changes. And so my brief presentation this evening builds and highlights efforts of partnership. I co-direct the Latino Center for Health, and we have a 5-year history, and we're housed here in the Department of Health Services, and we have really sought to shift the paradigm of research being generated in the academy and going to the community, but rather to engage the community and with listening to their questions, their concerns and aspirations and needs, to develop the questions to bring the necessary resources for change. The center is also committed to mentoring the next generation of scholars, and that's really important. And so I'm glad you're here with us tonight. And in the past year, we've been successful in securing $2.2 million just in grants and contracts this past year. We know from the literature that barriers exist. Barriers in terms of health access in Washington State. Nearly 1 in 3 Latinos and Latinas, for example, lack adequate health care coverage despite the implementation of the Affordable Care Act. So there's linguistic barriers. And when we look across different populations in the state, and what I will be sharing is the area of Skagit and Whatcom counties. It isn't just language barrier of Spanish, but of indigenous languages, such as Mixtec, Zapotec, and other indigenous languages. But there's a lack of familiarity to navigate. How many of you had trouble navigating to find this location? Okay. Well, to navigate an unfamiliar healthcare system with the scarcity of bilingual providers and practitioners is very much a barrier for many in the population. Fragmentary transportation systems can also be a barrier. The lack of insurance and fears and concerns regarding immigration. This study, the Population Health Initiative funded, and it is really a groundbreaking study, even though it's small in scope. Because what the literature identified in terms of barriers, this particular study didn't just allowed us to capture the voices and experiences that were lived among agricultural workers in Skagit and Whatcom counties, a region that is less studied and less understood. We know more about the Yakima Valley region than we do about Skagit and Whatcom counties. So in partnership, community surveys and assessments were conducted in 2018 with agricultural workers. UW researchers, the team, trained community-to-community promotores, or lay health workers, who administered 348 surveys to agricultural workers and also conducted 24 housing assessments. We're using that data currently to inform policy, practice, and advocacy efforts. Highlighting occupational safety. The findings are listed. 18% of the participants indicated that they had been injured at the work site, but only 21% reported it. Fear of losing their job, perhaps, if they reported it. Fear of not earning enough to provide for their families and loved ones. 34% reported having seen pesticides applied on or next to their homes. And 20% reported a lack of consistent access to drinking water. I chose this particular slide of a porta potty. And you go, occupational safety. Dolores Huerta, who has been a champion of rights of farm workers for many, many decades. She was a colleague of Cesar Chavez. Of all her great accomplishments in life, she has stated that getting porta potties placed on the fields is the greatest accomplishment that she has in her life. In terms of the impacts, Dr. Galaviz and her team, Dr. Spector and I were investigators. A student, Maria Blancas, and Maria is here tonight, and she'll be joining me in the circle later. She was a co-director of the project, the community-to-community partners, promotores, the actual respondents, the farm workers, and Rosalinda Guillen, the community activist, all contributed to organizing the conference on environmental justice that allowed a tour of the lived experience and workplace. And over 50 academics from various universities, Dean Godwin participated in it, but from Canada, Washington, Oregon, and California. Through this project, a strong and robust, and I would say a very meaningful partnership grew. 12 promotores were trained to continue the work. The work was never intended to be a one-off. The professional development of one PhD candidate, Maria, one MPH candidate, and 2 undergrads, they were mentored through this project and gained rich skills through this participation. Subsequent to during the course of the study, the Latino Community Fund awarded an additional $5,000 to continue the Promotora fieldwork. And importantly, from Group Health Foundation, $7,500 was provided to develop and make a video that is about 3.5 minutes long that highlights this project. It is important that we recognize the importance of agricultural workers to the state. We have, despite all the technology, we have roots in the ground. Agriculture produces about 10.6 or more in terms of money, but that really is dependent upon those who are harvesting the crops of apples and cherries and some of the items that we have enjoyed earlier this evening. I want to thank you. I look forward to further discussion with you, and just want to draw attention to the importance of the great work that is being done in the School of Public Health. And thank you to my colleagues. Thank you.